My name is Sam, and I am an employment specialist with Samaritan. So I assist in the recruiting for Samaritan. So I help the managers go through some different things and also help applicants kind of navigate that process as well. So as far as Samaritan, so what Samaritan is we are a health system. So we're located in Albany, Corvallis, Lebanon, Lincoln City, and Newport. So as a part of our health system, we have 5 hospitals in each of those locations. We also have over 90 clinics in both primary and specialty care. So what that means is primary care would be like your regular physician that you go see, your doctor that you go see all of the time. Specialty care would be, if somebody had some kind of a brain injury and outside of the hospital, they may have went to a specialty clinic that specializes in neurology or in orthopedics or different areas like that. So that's what specialty care is. We also have other services. So we have our Wiley Creek facility, and that is our assisted living facility and sweet home. We also have our STARS facility, which is a drug and alcohol treatment facility in Lebanon, an early learning center, which is in Lincoln City, which is kind of like a daycare learning center for children. And then also our Sam Fit facility. So those are all of our gyms that we have that are available for our employees, and then are also available for our community members as well. So kind of all of that, we have about a little over 5,000 employees. So that's Samaritan and what we do. And just to learn a little bit more about Samaritan, our employees, our mission, our values, I wanted to show a quick video.
I chose to work for Samaritan over having my own business because
I was looking. The sound's not working. Can you guys hear that okay?
It's working on my end. I can hear it just
fine. Some stability. That and with all of the camaraderie and the teamwork, the community that Samaritan focuses on, it was a perfect fit for me.
I think what makes Samaritan special and unique are the people that work here. We are a strong mission-minded organization, and I think as a result, we attract people that want to be part of that mission. And it's people that care deeply about our patients, our members, our communities, and also each other.
So before I started working here, during my interview, I really felt welcomed by the people I spoke to, and I just felt like the vision of Samaritan to just provide quality care was right along the lines of what I wanted to do with my career. If I were speaking to someone who is not familiar with Samaritan, I would say it's a pretty large hospital system with 5 hospitals, and we take care of a wide variety of patients, and the approach to patient care is centered but also very team oriented. And so it's a great place to work, and the people who work here are all fantastic.
Pride is our organizational values. It's how we expect people to work as individuals, but also how to work as a team. We take passion in what we do every day to provide the highest quality care to our patients. We need respect for our patients and our communities. We have to act with integrity. We want our communities to trust who we are and make sure we continue to earn that trust every day. We act with dedication. We need to decide, how can we do things better? How can we take initiative to make sure that we're a better organization for our patients and for our communities? And then we need to strive for excellence. We need to always think, how can we exceed the expectations of our patients? We all own the patient experience. We have some employees, physicians, providers that are working directly with our patients every day, and we expect them to live those pride values when they provide that care to our patients. We have other people in the organization that don't necessarily have contact with patients every day, but we also expect them to own that patient experience. I recommend for all those folks to look around and see what can they improve, whether it's directly or indirectly, that enhances that patient experience.
We are here for one thing and one thing only, is patient care. So we need to come together as a team, no matter which department you work in order to achieve that.
Something that every employee can do to enhance the patient experience is when they show up to work each and every day, realize that they are the patient experience.
I'm able to support people on one of the scariest days of their life. Coming into the emergency department is intimidating and scary, and I'm able to support the patients and their family, as well as be supported by my coworkers to do what's best for the patient.
I'm very proud of Samaritan and the work I do, mainly because we provide our patients with not only clinical care, but comfort. We hope our patients feel comfortable with our team and our hospital in general.
I think if we work together as a team in a very aligned and focused way, this organization can do fantastic things in the future.
Great, so that was a little bit more about Samaritan and our mission, vision, and values of Samaritan and Samaritan Pride. So demonstrating pride. So how we demonstrate pride here at our organization and how we expect others who may be entering our organization to demonstrate pride could include showing up. So showing up to the interview, showing up to work, being on time, being ready to work when you're supposed to be, respecting others, whether that's coworkers, patients, visitors, respecting others in your personal life as well, making sure that we're being respectful and essentially, doing the right thing. And as everybody has probably already heard, treat others how you would want to be treated as well, even when no one is looking. So that's the integrity piece, making sure you're doing the right thing, what feels right, even if no one else is looking as well. And then being committed to what your goals are, being committed to what you're supposed to be doing, or committing to whatever commitment you have. So for work, for example, or for school, making sure that you are fully committed to school or fully committed to work in whatever capacity that you're doing. And then doing your best, always striving for excellence in everything that you do. So some common healthcare jobs that you guys may be aware of, and kind of what we have, of course, as well, is of course a doctor. Have those opportunities, nurse, pharmacist, and medical assistant. Those are some of the different opportunities. Medical assistant are usually those individuals where you go into the doctor's office and they're the ones who see you before you see the doctor, and they're helping you to know more about you, if you have any allergies, all of that stuff. So that's what medical assistant is. Some other opportunities that we have that you may not necessarily know of is housekeeping, keeping all of our facilities clean, whether it's offices, hospital rooms, all of the above. Nutrition services. So when you go into the hospital, the individuals who are either preparing your food while you're in the hospital room or preparing the food for your families, accounting, marketing, human resources, which is what I'm in, information technology, both on the information technology side for our hospital system, so like our health record system, but then also in other areas as well. Maintenance. So, we have people to help maintain our medical equipment, but then also to maintain our facilities as well. That does include like groundskeeping. We have some opportunities there, inventory or storekeeping. So all of our materials that come in, bandages or syringes or needles or any of that materials that come in, we have individuals who unload all of that or take them to the appropriate locations within the hospitals. And then of course, clerical support as well, customer service, different opportunities in that realm. One other piece that I had failed to mention as well that we have is our own health plans. So the health insurance that individuals have, both Samaritan employees, but then also other organizations. So that's another side that we have a lot of other individuals work for us in different capacities. So essentially, these are all of the positions that you need in order to run any kind of business typically. So there are different requirements that kind of go into healthcare, different healthcare jobs. They all kind of vary. Not all of them require any necessarily higher education beyond high school. So for example, for a CNA, it's typically a 6 to 8 week program. And then to become a CNA 2, you would go through another program and become licensed through a board. RN would be 2 to 4 years of education. And then a medical assistant or CNA would be 1 to 2 years. And there's also different positions in the lab. So to be a phlebotomist and become certified would be about 15 weeks. Medical lab tech or medical lab scientist would be 2 to 4 years of additional education. Those two are usually testing for different things within the hospital as well. So different conditions people may have, or trying to research what may be wrong with somebody. Pharmacy, there's some different requirements there, as well as rehab and cardiopulmonology. So there's some different requirements for each of those, depending on what kind of level somebody would be interested in. And then there are some other positions that don't necessarily require a college education or additional training, such as housekeeping, dietary culinary aid. Those are those individuals I said that would be working in the hospital kitchens to either give the food out to individuals, or to help serve the food in the hospital rooms. Storekeeping, sterile processing. Sterile processing would be processing the materials in the OR. So in the operating room, they need to have sterile equipment to be able to work on individuals and do surgery. So those individuals help with that. Medical office receptionist, admitting. Admitting is those people who, when you first walk into the hospital, they're the ones that help you to be registered in the hospital, get your insurance information, all of that. Any questions about any of that? I know it was kind of quick there.